Let's bring in New York City physician Dr. Devi Nampiaparampil. Okay, I'm going to say this right. Nampiaparampil. I'm so sorry. I'm trying. She is the founder of Metropolis Pain Medicine and the author of Coronavirus Made Simple. I am so sorry for every time I say your name, I practice it so many times, and yet when it comes to saying it live, I can't do it. All right, so let's start with the long-term risks of potential mental health issues that children may encounter during remote learning. Do they outweigh the short-term benefits, do you think, of mandating COVID testing for public school students?
Over the past couple years, it seems that it does. We see depression and anxiety increasing as people do more remote learning. We've seen the suicide rate increasing. Now, it's hard to separate whether that's from the remote learning or whether it's from the virus itself or the lockdowns. But it seems that as people are deprived of, seeing their peers, kind of the benefits of working with others and the education that they really gain from the school in-person setting, that's what's contributing to all of those negative effects. Now, I'm concerned about the psychological well-being of the kids, but also the physical well-being, because if you separate kids out, not all kids are the same, right? So there are kids that are healthy, that's the majority of kids. There are kids that need special services, so some of them are sick, they're immunocompromised and stuff. Now, we have learned about remote learning and how to do things virtually, so some of those kids who are high risk for having COVID complications, maybe for them there can be an exception and they can be kept at home because the risks of being in school would be greater than the benefits. But if you think about the other kids, there are some that are at risk for other problems, like they get food, from school, they get psychological services, they get services in terms of their physical disabilities. They really rely on school for a lot more than solely education. So they really need to be in that face-to-face setting, especially when it comes to child abuse screening and other things that we
No, I agree. And educationally, it is a huge setback, not to mention the mental health statistics that children suffer according to this latest statistic. Let's look it up on the screen here. During the pandemic, 25% experienced depressive symptoms, 20% experienced anxiety symptoms, and emergency room visits for suspected suicide attempts in early 2021 compared to the same time period in early 2019. 51% higher for girls, 4% higher for boys. Why do you think girls are suffering more, so much more?
Well, we don't know if it's necessarily that they're suffering more or they present more, because I think people are used to screening for things a little bit more in girls, so there could be that. Also, at least in terms of society, in terms of suicide attempts, girls and women also tend to use pills a little bit more than other violent means. So it's hard to tell exactly what's going on, but we need to be more vigilant in both groups. I think also, there's a connection in society. Like, I think girls tend to connect a little bit more through their peer groups to other people, versus boys sometimes are a little bit more isolated to begin with. So there's different patterns of socialization. I think also if we look at how schools are kind of doing their testing, even now, let's say face-to-face schooling, there's a lot of separation, at least in New York City, between how it's done for kids who are vaccinated versus those who are unvaccinated. I think that sets things up also for bullying among kids and other types of behaviors. So some of the things that we've looked at in the past before COVID, some of those behaviors may not apply right now, but we need to be really careful about how we're stigmatizing kids and the social stigma and other things that are going on in our society.
Dr. Nampiaparampil, thank you very much for talking to us. We appreciate it. Happy New Year. Trace.
Happy New Year.